After 3 weeks, there are still lingering questions related to Senator Mitch McConnell's health, and it's adding to growing examples of a lack of disclosure and transparency among elected officials. The Republican from Kentucky was admitted to the hospital on June 14th. McConnell's aides have not explained why he was hospitalized or what treatment he's receiving. The latest statement we have from his team reads, quote, Senator McConnell appreciates the outpouring of support he's receiving while he continues his recovery in the hospital. The senator continues to improve and is working closely with his staff on Kentucky and Senate matters while the Senate is out of session. Okay, that was released on July 2nd. That is 5 days ago. The lack of information follows the 3-month absence of New Jersey Congressman Tom Kean, who just recently explained he was struggling with depression. Under the Biden administration in 2024, questions swirled over the handling of then Secretary of Defense Lloyd Austin disappearing from the public eye for days after a health scare. Let's bring in MS Now congressional reporter Michael Schnell. Max Rose is still with us. There have been developments just since we came on air, Michael Schnell.
Yeah, we're just learning. I'm just getting statements in from the spokesperson for Leader Thune and the spokesperson for Whip John Barrasso. To put it into perspective, this is the top Senate Republican and the second-ranking Senate Republican. Both of them have spoken to Mitch McConnell in recent days. So I'll read you what I'm being told. This is first from a Thune spokesperson. Quote, Leader Thune spoke with Senator McConnell yesterday by phone. They had a lengthy and substantive conversation that covered a variety of topics, including national security. We're also, again, learning that John Barrasso, the number 2 Senate Republican, has spoken to Mitch McConnell. I'll read you a statement from his spokesperson. Quote, Senator Barrasso and Senator McConnell had a lengthy conversation early this afternoon. Their phone call lasted roughly 20 minutes. They spoke about a number of topics, including the Graham-Plattner scandal in Maine, Supreme Court rulings, the NDAA, that's the annual defense bill that's being discussed on Capitol Hill right now. And the last sentence of the statement is, quote, Senator McConnell was fully engaged and is eager to get back to the Senate. This notable because, as you mentioned, Alicia, we aren't getting a lot of information from the office. I followed up with the office this morning. They sent me along that July 2nd statement, which doesn't really give an indication of his condition. I've been speaking to a number of Senate aides today and senators themselves. Nobody really seems to know just what Senator McConnell's condition is. Obviously, a concern. He has a key vote in the upper chamber. He is 84 years old. He's been serving since 1985, and there is just no indication right now of why he is in the hospital and what his condition is. But again, these two very key Senate Republicans saying they have spoken with him and that he is doing, I guess, well. They're holding up a conversation with them.
Okay, so all of those statements come on the heels of Breitbart's Washington bureau chief calling for McConnell's staff to prove his condition. Yeah. There is a lot of interest, especially on the right, about where he is, why they have not heard from him. Is this cleanup on aisle 6?
They're lying. I mean, these key Senate Republican leaders are lying. One way I know that is because Senator Barbarossa couldn't have held a 20-minute phone call with Senator McConnell previous to this medical incident. That's how bad of a shape this guy was in. This is something that both Democrats and Republicans have been susceptible to. They get so locked into the office, so ingrained in the institution, and so addicted to it, as well as their staff, that despite historic, undeniable medical decline right before our very eyes, they hold on. And this is perhaps the clearest example of this yet.
McConnell's not indicated any plans to resign at this time, but his hospitalization is raising questions over what his succession would look like. I want to read a little bit, and then you and I can talk about it. Kentucky State Senate eliminated the governor's ability to appoint a replacement senator, instead directed vacancies to be filed through a special election process. His term expires January 2027. Yours, is this even a conversation Republicans are having on Capitol Hill?
Not right now. Frankly, I spoke to one senator today, and I asked, does anybody know about it? Senator McConnell's condition. They said senators don't really talk during the off season when they're not in session if they don't have to, so they haven't discussed this. But they assume it's going to be. But they assume it's going to be a topic of conversation when they return next week. I think it's certainly in the back of minds of some people because it's also important to note this is not Mitch McConnell's first health scare. He had a concussion. He had some previous falls. He's been in the hospital in the past. Anyone who sees him in the Capitol, he used to walk while holding onto an aid. Now he gets rolled around in a wheelchair. I mean, there are some just general concerns with his well-being well-being, and particularly with this elongated hospital stay, yes. And you mentioned that in 2024, Kentucky legislature, they changed the law to say that it's no longer an appointment by the governor for a replacement if there is a vacancy in the middle of a term, but it's a special election. But it raises a lot of questions of, well, we're very close to November when you talk about the calendar year. So the amount of time it takes to set a special election, to have candidates, to get those ballots on the schedule, it could take a long time. And so the law doesn't actually say what will happen if a vacancy happens so close to November. It's certainly a gray area. It's certainly an unprecedented situation right now. And again, all coming to the fore as there are these real concerns about just what is Mitch McConnell's condition.
Look, if he could do a 20-minute phone call with Senate leadership, he could do a 20-minute phone call on live air. I mean, this can be so easily wrapped up. They're lying. The guy is either in a coma or is in such like a medically sorry, tragic state that he couldn't do that.
Which we don't have any evidence of, and that is part of the problem when folks are not transparent about what is happening. And to me, because I don't want to get out over our skis here, what we do know is it also comes on the heels of Tom Kean Jr. being out of commission for 3 months and being unwilling to communicate with people. And that as a standard, which, you sort of talked about when people are physically, changing in front of our eyes. There's also just the absence of information and this sense that there's nothing owed to their constituents, right? That you're supposed to have a member of the House, you're supposed to have 2 members of the U.S. Senate who work for you, and as such, you deserve an answer about whether or not they're have the capacity to show up to work.
This speaks to the way politics used to be. I mean, you go back 20, 30 years, they could get away with this stuff, right? There wasn't the 24 social media cycle. There wasn't, such deep analysis of this. And those are all like very good things. But these days have long passed. And when you think about why is everyone so pissed off on both sides of the aisle, it's not just policies. It's not just the ridiculous fascist behavior of this administration. It is also just this behavior of these senior leaders who act like they are above it all and who also think that we are just utter idiots. Yes, we had a long, lengthy 20-minute phone call. And, oh, yes, the senator's in great condition. But, no, I'm sorry, he can't talk to anybody else.